The hidden cost of waiting. How online self-help saves time, money and lives. Let's start with a hard truth. Every day someone waits for traditional mental health care. Their condition often worsens and the financial burden grows. In the US, the average cost of a single outpatient therapy session ranges from $100 to $500, while inpatient programs soar to $2,000 per day. Governments pour billions into mental health initiatives, like New Zealand's $2 billion package, yet outcomes remain stagnant due to bureaucratic delays and misallocated funds. Meanwhile, online self-help courses deliver comparable results for a fraction of the cost, often free, while eliminating wait times entirely. The price tag of delay. Consider this. A person with moderate depression might wait 8 weeks for a first psychiatry appointment. During those 60 days, their productivity drops by 40%, relationships fray, and they are 3 times more likely to develop comorbid conditions like substance abuse. Economically, this delay costs employers over $3,000 in lost productivity per month. By the time they finally start treatment, their case is more complex, requiring 50% more sessions to achieve remissions. Traditional programs compound costs through inefficiency. For every dollar spent on direct care, 25 cents vanishes into administrative overhead. Government initiatives far worse. New Zealand's $455 million access and choice program underspent by 9% due to delays, while Alaska's $10,165 per client mental health spending yields minimal return of investment compared to culturally adapted digital tools. Online courses, faster, cheaper, equally effective. Online self-help courses slash costs and timelines. Peer-reviewed studies show digital CBT reduces depression symptoms as effectively as in-person therapy, but in half the time. While traditional programs take 12 weeks to show results, online users report improvement within 4 weeks. This speed isn't just convenient, it's life-saving. For every month untreated, suicide risk increases 15%. Financially, the contrast is stark. Traditional 12-week outpatient program, $4,800, which is 12 sessions at $400 each plus $1,200 in lost productivity, equals $6,000 lost. Online course, almost zero implementation costs and 30-minute daily modules that have no cost. But free doesn't mean valueless. Peer-reviewed studies show these courses save systems $18,000 per user annually by reducing emergency room visits, sick days, and long-term disability claims. The white label advantage. Pay what you save. As a charity, we don't charge fees, but we invite organizations to reinvest a fraction of their savings into scaling access. Here's how it works. If our white label course saves your organization $18,000 per user annually, consider contributing 10 to 20% of those savings to fund course development for underserved communities. This model mirrors corporate training partnerships, where reinvesting 15 to 25% of return of investment into program expansion is standard practice. Why this works? For every $1,000 donated, we can co-create and deliver courses for 10 additional users, amplifying your impact exponentially. Tax-deductible giving aligns with corporate social responsibility goals while addressing systemic mental health gaps. Scalability. A mid-sized company with 100 employees saves 1.8 million annually using our courses. A 10% reinvestment funds courses for over 1,000 users in marginalized communities. The speed factor. Traditional programs take 12 weeks to show results. Our courses deliver improvement in 4 weeks. For organizations, this 8-week acceleration cuts productivity losses by $3,000 per employee, which funds the reinvestment model without touching budgets. Closing argument. This isn't charity, it's a strategic partnership. By redirecting a fraction of your savings, you transform mental health care from a cost center into a force multiplier. Together, we prove that healing can be both immediate and infinitely scalable. Approximately 978,000 people identify as Maori, representing nearly 20% of New Zealand's total population, according to the 2023 census. This reflects a 12.5% growth since 2018, with Maori now making up 1/3 of the under 25 population in regions like the far north and Gisborne. Sami population in Sweden, estimated between 20 and 40,000 people. Exact numbers are challenging due to self-identification and Sweden's lack of ethnic censuses. The most common estimate centers around 20,000, concentrated in northern regions like Swedish Lapland. Why these numbers matter? Understanding these demographics is critical for tailoring mental health initiatives. For example, Maori youth under 25 dominate regions like Opotiki with 85% and Rotorua over